At the time, we had a 1-year-old and a 3-year-old, and I was 24 weeks pregnant with our third boy. I was going in for my normal ultrasound, and I had just noticed a lump that week, and so I showed it to my OBGYN, who then sent me to the breast surgeon. We knew that it was likely breast cancer. They were really good about telling us, like, we can't say it before the biopsy, but this is very likely breast cancer. It was just a complete shock. So scared. We waited for 2 days for those biopsy results, and those 2 days were really scary, just not knowing if it had spread or kind of what the prognosis would be. It was just really devastating, just kind of looking at my kids and thinking, like, I want to be here to watch you grow up. And so then once we got the call, my breast surgeon called me and said, this is treatable and it's curable. And so once I heard those words, I was like, okay, we can do this. This is just something we have to get through. And then from there on, we really just have felt really hopeful. And I've just never felt as scared as I did those first couple days. And then we just had like the best support system ever. So after 4 rounds of chemo while I was pregnant, then I had the baby at St. Mary's. I just kept thinking, like, oh, I've met the best group of nurses and doctors. And then every single next group was just blowing me away. The nurses on the postpartum floor were amazing. The charge nurse was also a breast cancer warrior. And so she came to talk to me, and she brought me a little guardian angel statue that she had brought to all her chemo treatments. And so then I brought it to all my chemo treatments. And our baby was in the NICU for 7 days, also at St. Mary's. And so we met another great team. And one of those nurses was also a breast cancer warrior. One of the NICU nurses helped coordinate getting us breast milk from another person that she knew. The nurse that we had like for all 7 days almost, she was picking up shifts so that our baby could have the same nurse days in a row. And then I jumped right back into chemo, and so went back to all those infusion nurses. The day I rang the bell, I was just kind of tearing up all day, just feeling super relieved. All the nurses were there to celebrate with me as the last chemo was going. And then, of course, both of our families and friends came up, and our kids came, and I rang the bell, and all the nurses came outside and got to meet my family, and they just really shared in our excitement and our joy. It really felt like they were also friends, and they were so happy for us, and they all had been praying for me the whole time. And so it was just really neat to celebrate that with this group of nurses that I had gotten so close with. It was really evident that SSM staff was living out the mission and values. Every single staff member had so much compassion, and just it was so evident how much that they love their patients. And I know that because I work with all the nurses and doctors at SSM, and I've always known how much we love our patients, but then to be on the other side of it and really receive that compassion and love as a patient just blew me away. And now I know like what a really big difference that makes to feel that, because you're getting expert healthcare and you're getting the right care, and that would be enough. But to have everyone be delivering that care with so much compassion and love, and you know how much they care about you, and they're praying for you, and they end up loving you, and that just, I think, helps with healing so much, and it makes all the difference in your healthcare journey.